Mr President, I would like to bring the House's attention to the work of an outstanding research institute and the crucial need for it to be supported. The Asbestos Disease Research Institute, known as ADRI, is a not-for-profit organisation located in the Bernie Banton Centre at Concord Hospital. As a result of our nation's asbestos history, the Institute plays an essential role in helping our communities. Due to our past high consumption of asbestos-containing materials, asbestos is entrenched throughout workplaces and schools. 1 in 3 homes built or renovated prior to 1987 have asbestos in it. Over 15,000 Australians between 1982 and 2015 were identified as having malignant mesothelioma. Tens of thousands more have been diagnosed with different forms of asbestos-related diseases. Devastatingly, there are over 700 cases of malignant mesothelioma every year. Globally, our nation has one of the highest numbers of asbestos-related diseases cases per capita, which is highly distressing. There is no cure for these diseases. Subsequent to a diagnosis, sufferers usually pass away within 9 months to a year. Patients experience horrific suffering and there is no available treatment to try to sustain and lengthen their lives. ADRI's ultimate objective is to save lives from asbestos-related diseases, including silicosis. They are working tirelessly to achieve this through investing in laboratory research, clinical sciences, prevention and public health. The Institute is a world leader in preclinical research. Researchers are working on a variety of molecular and biological techniques so that these diseases can be cured and prevented. ADRI has a world-renowned record for conducting groundbreaking work that improves methods of prevention, diagnostic frameworks and therapeutic procedures and treatments. ADRI's director is an international expert of the World Health Organization. The Institute is regularly engaged by the UN for assistance due to its pioneering work. The Institute raises awareness to alert, educate and train people to avoid the risks of exposure in our communities, helping to prevent further cases and suffering. ADRI support service is critical for sufferers and their families. Registered nurses use current survivorship and carer need research to provide bedside phone and group meeting support. Unfortunately, all of this crucial work will end up ending if ADRI is not supported with adequate funding, as it does not have the finances to continue its life-saving efforts. As reported in the AFR, James Hardie was providing funding of $500,000 per year to the Institute as part of a 10-year funding agreement with the Australian government. This has now ended. Unfortunately, now that James Hardie is no longer obligated to keep the funding going, it has stopped, placing the Institute's survival in jeopardy. I have been told there have been recent positive discussions between ADRI and James Hardie, and they will be making a decision in approximately 4 weeks regarding future funding. It is pleasing to hear that James Hardie has taken a first positive step. This is a tiny amount of money for a company like James Hardie, and I believe the company has a social responsibility to make sure contributions to ADRI, due to their role in causing an overwhelming amount of the asbestos-related diseases in both our state and nation. I hope that James Hardie does the right thing and looks to the example set by CSR, who have increased their funding support by 50% per annum. Unfortunately, even with this funding, ADRI's operational costs cannot be covered to ensure its survival. The New South Wales Government helped establish the building where the Institute resides, and now it should consider directly funding ADRI to ensure it does not become insolvent. ADRI does not qualify for the New South Wales Health Medical Research Support Program, as it's a small specific disease organisation without a high enough income to meet the criteria for the funding. Peer review grants also do not cover enough of ADRI's overall outlays, including infrastructure costs. I believe the government also has a social responsibility, along with James Hardie, to ensure that a world-leading institute can continue its vital research and its support of sufferers and their families. The objective of ADRI is to make asbestos-related diseases history, and this will not be achieved without adequate funding.